Hi, I'm Emily.
And I'm Annalise.
For our topic for historical analysis, we chose to focus on the history of occupational therapy's role in feeding. Finding references from the early decades was quite difficult, but after many hours of research, we found articles that allowed us to tell us the story of a scoping history of feeding and how occupational therapy established and developed their role in this area of activities of daily living. We chose this topic because we thought it would be really interesting to learn more about, as this is an emerging area of practice that is really important. No one has addressed feeding specifically in the past, and no one has even written extensively about feeding as a component of activities of daily living.
As we know, feeding and swallowing is standard number B416 of our current 2018 A-Code accreditation standards titled Dysphagia and Feeding Disorders. The accreditation standards for a master's level educational program for the occupational therapist is defined as being able to evaluate and provide interventions for dysphagia and other disorders of feeding and eating to enable performance, and train others in precautions and techniques while considering client and contextual factors. We found that this is something that is not discussed about enough. We, as graduate occupational therapy students, think it would be crucial for this topic to be integrated more into our curriculum so that we can have a better understanding of feeding as a whole and the issues that can occur and how they pertain to occupational therapy.
We're going to start our discussion with you with trends we found in the 1910s, and we'll continue on with each decade and how occupational therapy has evolved its role in feeding. In the 1910s, we found trends that involve infant feeding and how the knowledge of infant and child feeding development at this time was widely disagreed upon.
This is definitely an area that would need an OT because I remember in our pediatrics class, we learned about the developmental milestones.
In hindsight, occupational therapy could have played a large role in educating the mother on proper infant feeding and advocating for her rights and ability to care for her child.
But unfortunately, we weren't there yet in our professional development.
Exactly. Occupational therapy can help advocate for education of mothers in the area of proper care for their child because medical professionals of this time period blamed infant feeding solely on their mother. In the 1920s, we found that researchers continue to suggest a woman is unable to individually care for her own child and suggest that if an infant is to be deprived of breast milk, that the child should be under the direct care of a physician, as that would be the only way to ensure that the infant will receive proper nutrition.
As we know, an occupational therapist would be able to look at the mother with a holistic view and find barriers that can be adapted to ensure proper feeding and nutrition without placing blame on her for not being able to or not wanting to breastfeed.
A major trend we found through research that we were both shocked to see how early on this was dysphagia. This decade played a major role in the education of deglutition and dysphagia.
We were both aware of dysphagia, the difficulty in swallowing, but had to look up to see exactly what deglutition was.
Yes, we both learned that deglutition is the action and process of swallowing. From research of this decade, we gained much information about different disorders that can lead to dysphagia and have an effect on deglutition. We also learned about early techniques and substances that were used to enhance swallowing.
With this early research on dysphagia and deglutition, we saw that further intervention of various medical professionals is needed, and that this is continued to be seen throughout future decades as occupational therapy becomes an up-and-coming profession.
As many of us know from our research and education, the 1930s were an essential time period for occupational therapy. Research shows that occupational therapy became a profession considered indispensable in many hospitals and organizations.
Yes, it was in the 1930s that workshops started to be used to address physical disabilities. These workshops focus on activities of daily living, and we're all aware that feeding is a daily life skill that occupational therapists work with clients to become more independent in.
Continuing from research in the 1920s, where we learned about early disorders and disabilities that affect dysphagia and deglutition, research studies continue to show the importance of proper positioning and techniques in which occupational therapy can play a major role in educating clients. Throughout the 1930s, research continued and studies were shown that occupational therapists can help clients with different disabilities and conditions such as multiple sclerosis.
Occupational therapists can help clients find adaptive equipment and therapeutic techniques to help individuals become more independent in feeding. It's also important that clients receive proper education on the equipment and techniques, which occupational therapists can provide.
It was in the 1930s that infant feeding continues to be a topic of interest as there was much progress made with artificial feeding. It was now that artificial formulas were shown to contain the same essential nutrients as milk straight from the breast, and details about psychological aspects of feeding and behaviors were started to be focused on.
Yeah, as stated earlier from our research in the 1920s, where an infant should be placed under the direct care of a physician if the mother was unable to breastfeed. In the 1930s, research showed that if a physician had proper insight and an understanding of the mother, proper education of breastfeeding was shown to have benefits and eliminate potential barriers.
We know as occupational therapists the importance of advocating for our clients, and it's evident through research that advocating for mothers caring for their infants was most definitely needed.
Yeah. And in the 1940s, assessments of oral motor movements of the lips, tongue, and throat were introduced in hospitals addressing the care of children with cerebral palsy.
I was surprised to learn that there were assessments beyond those just for upper extremity movements involved in self feeding this early in time.
I agree. I was also surprised to learn that a common intervention for the neuromuscular education of upper extremity self feeding movements included weaving.
That is so interesting. It makes sense that repetitive movements required for weaving may mimic those necessary for feeding.
Exactly. When set at a proper height, various forms of weaving address the grasp, elbow, and shoulder functions necessary for good feeding practice. Weaving also addressed maintain balance and, like you said, patterned repetitive motion similar to that during the feeding process.
This decade was also noted for infants' difficulty involving the pressure of milk flow during breastfeeding, right?
Yeah, OT could have played a role in addressing the tactile issues of breastfeeding due to their vast knowledge of sensory processing.
Definitely.
As we move into the 1950s, our research shifted focus to timing, nutrition, interdisciplinary teams, and adaptive equipment in feeding.
To clarify, timing involved with feeding, meaning the pacing of how fast or slow a meal is eaten, as well as establishing eating routines, especially for children.
As we know from the occupational therapy performance framework, establishing routines is an important area of one's performance patterns.
Yes, this decade was also important for interdisciplinary teams in the treatment of feeding.
A research study at a London hospital in 1953 proved speech and OT, who worked together on interdisciplinary teams to address feeding, were highly effective. This study also identified postural support needs involved with feeding.
Oh, wow. Occupational therapy is definitely well equipped to support positioning and posture.
And well equipped to introduce and educate people on the use of adaptive equipment. In this decade, built up and weighted utensils were developed to mitigate the negative effects of tremors during self feeding.
The usage of adapted utensils expanded into the 1960s as part of occupational therapy intervention for those with Parkinson's disease, right?
Yeah, in order to address the muscles and movements related to these patients' symptomology, occupational therapists adapted the environment and utensils used to foster independence for these patients. Attempts were also made at this time to create adaptive equipment for patients diagnosed with arthrogryposis multiplex congenita, which supported upper extremity movements to self feed.
Were the attempts successful?
Yes, and now, although the adaptive equipment may not have been right for the trial patients, the results suggested the device would be effective for those of differing diagnoses.
It's so interesting how period issues were identified as also being diagnosis related.
Right? And in the 1970s, psychosocial issues surrounding feeding began being addressed through an applied behavioral analysis approach that was developed to address feeding behaviors.
Was that approach effective?
Yes, it was effective in reducing tantrums during meal times. This approach became very common in OT feeding interventions and developed further in years to come. Now, as we entered the digital age, we found less difficulty in finding articles that relate occupational therapy to feeding. Many of our articles came directly from occupational therapy journals and specify the important role occupational therapy can play in all aspects of feeding. While in previous decades, we found we had to connect occupational therapy to a topic in feeding and explain how occupational therapy would be beneficial.
As we progress throughout each decade, research has continued on occupational therapy's role in various pieces of adaptive equipment. In the 1980s, we found that the role of adaptive equipment was starting to become more detailed for pieces of equipment specific for certain disorders, condition, and even certain foods.
Yeah, we were both surprised to find an article that specifically focuses on feeding devices for finger foods for clients with physical disabilities from any background. Researchers of this type of adaptive equipment focus on finger foods such as hot dogs, pita sandwiches, and even ice cream cones, which we really enjoyed learning about.
As research continued for the 1980s, we found that the importance of a healthy feeding relationship was starting to be focused on occupational therapy practice. I think we were both shocked to see how this wasn't considered an important part of feeding therapy prior to this decade.
Yeah, we both agreed that since we consider a healthy relationship with feeding and food to be such a crucial topic in today's age, we would have definitely expected it to be studied in earlier decades. But hey, better late than never.
Early research showed that in a positive feeding relationship, the mother and infant are able to develop synchrony.
We were able to relate this back to research from the 1930s on the psychological aspects of feeding and how negative emotions can affect feeding.
With knowledge from earlier decades and building on that knowledge, we learned that the feeding relationship is a complex of interactions that take place between parent and a child as they engage in food selection, ingestion, and regulation behaviors.
Research from the 1980s also discusses a feeding relationship involving a caretaker, not just the parents, and how it is important to find proper trust.
I loved seeing early research that involves the caretaker and the importance in finding a role in their ability to feed an infant.
To finish up what we learned about occupational therapy's role in feeding in the 1980s, while conducting research, we started to see a lot more of assessments that were starting to be conducted for clients of all ages.
We found assessments on AJAT that range from infants to elders. This includes the behavioral assessment scale of oral functions in feeding and the assessment of feeding behaviors of the institutionalized elderly. What I truly loved about researching occupational therapy's role in feeding was how the idea of group programs came to life. Wouldn't you agree?
Yes, totally. We found a research study that involves occupational therapy's role in running group programs for parents as caregivers and to provide education and guidance for nutritional and behavioral management by professionals.
This research showed that the interaction of parents and professional in a support group format can be a successful approach to early eating problems in children. We know from various classes we took the benefits of group programs, and it's amazing to see early research, especially for our topic.
As you can probably assume, continued research on various techniques and adaptive equipment for feeding difficulties in clients with physical disabilities, such as quadriplegia and head injuries, were continued in the 1990s.
Yeah, I think we were both shocked to see the trend of techniques and equipment evolve through each decade. It was also super interesting to see early research on the common technique in today's age, suck, swallow, breathe coordination during nipple feeding, and occupational therapy's role in preventing dysfunctional oral motor movements or in coordination with the suck, swallow, breathe coordination, which would definitely delay discharge from the NICU.
Yeah, I remember learning about that technique in pediatrics. So I agree that it was interesting to see an early article about the start of this technique and how it was evolved. In the 2000s, the occupational therapy and speech therapy roles involved in interdisciplinary feeding interventions were defined as pertaining to dysphagia and older adults. Occupational therapists address feeding, while speech language pathologists address eating and swallowing.
But what makes feeding different from eating and swallowing?
Feeding includes the process of bringing food from the plate or cup to the mouth, but also considers cultural practices and beliefs. For example, different cultures use utensils or don't use utensils for certain foods.
Oh, that makes sense since occupational therapists are appropriately and adequately trained in meeting the complex needs of older adult patients with feeding difficulties.
Right. Also, in 2009, adaptive equipment research was developed, proving specifically designed feeding devices are most effective in allowing patients to eat independently and generate positive experiences involved with feeding.
Wow, since occupational therapists are so well versed in using adaptive equipment and providing client centered care unique to each client, this sounds like the perfect place for the role of OT.
Right? In the most recent decade, research in occupational therapy treatment of feeding issues in children with autism spectrum disorder showed satisfactory results, especially in addressing the sensory and behavioral needs of children with autism spectrum disorder.
In this specific study, caregivers reported that while nutritional services were helpful, they were not considerate of sensory needs and difficulties, which is an area occupational therapy is very well versed in.
Yeah, and behavioral needs as well as important influences of the relationship of the caregiver involved in feeding and the environment for feeding has in the feeding process.
During this decade, occupational therapy treatment began to emphasize the importance of the role of caregivers that they play during feeding in the treatment of pediatric feeding disorders.
Yeah, this further developed the research that you mentioned in the 1980s involving caretakers. And on the other end of the age spectrum, OT assessments for older population of participation in food-related occupations has been further developed, like the occupational performance measure of food activities.
Oh, because food related occupations have proven to improve nutritional risk among older populations.
Yep. And finally, during this decade, the American Journal of Occupational Therapy published guidelines for OT to define feeding as an activity of daily living and occupational therapy's role in this occupation, stating, occupational therapy practitioners are uniquely positioned to assess and treat difficulties associated with feeding, eating, and swallowing because of the profession's holistic perspectives of recognizing and assessing not only the physiological factors, but also the psychosocial, cultural, and environmental factors with these aspects of daily performance.
Wow, that is a huge step for occupational therapy practice and feeding. On that note, we want to thank you for listening, and we hope everyone learned something about the progression of occupational therapy's role in feeding. From our research, we gained so much useful information, and it was interesting to see the evolution of occupational therapy. We are excited to learn about your topics and how occupational therapy has become a well known profession in the medical field.